Welcome to the Pivotal Podcast. Today we're joined by Jenny Evans, Program Director of Health Informatics at the University of Findlay. Jenny has a unique background that blends healthcare, education, and informatics with a passion for integrating real-world applications into academic programs. In this episode, we'll explore Jenny's career journey, her approach to health informatics education, her innovative projects, and her perspective on the evolving role of technology in healthcare. Jenny, thank you so much for being with me today.
Thanks for having me.
Yeah, I'm excited about having this conversation. So let's jump right in and tell us about what you're working on currently. What's your role at the university?
So currently I am the program director for the health informatics program here at the University of Findlay. It is a master's level program, but we also have a certificate, and we're looking at, what can we do to make us stand out in, the realm of, masters of health informatics programs. So I guess I'm the head ringmaster a lot of times of, coming up with some ideas and shooting them at my faculty and saying, hey, you guys think this will work? And they laugh and say, yeah, let's go for it, kind of thing. So that's kind of where I'm at this point in time of things.
Yeah, that's awesome. So what initially drew you to informatics?
So I still don't know what I want to be when I grow up. So I am very much that one person that medical has always infatuated me since I was a little kid. But I don't like bodily fluids. So exactly.
So same.
Yeah. So I was all about, what can I do? How can I get into it? How can I get, this, that, and whatever. So started out, I moved into medical records when I eventually got there, and then I got to the point of, I got tired of hiring people that didn't know what they were doing. So I went into academia at that point, and I thought, well, what better way to go to the problem is to go to the source, at that point. And as I started into HIM teaching it, I've constantly wanted to do what's coming, what's the next thing, what's technology doing that's going to help us. And so, I taught at an associate's level in health information technology. Then it was kind of funny. I got poached in a parking lot in at a conference one afternoon that says, hey, we've got this position at the master's level we think you would be really good for, come on up and see us, kind of thing. So looked into it. Yeah, I loved it. I love technology. I love new things. I'm one of those that if I get bored with something, I move on to the next thing. And that's kind of where I was. I was in HIT that, I've got it to where it needs to be. Now what's my next step? So in informatics was it worked perfectly for what I was wanting to do then. So it was an easy transition then. So building that technology piece into what are we trying to do in healthcare then?
Yeah, absolutely. That's super cool. So it sounds like personally that fulfilled that need for growth and change. But what else is there that's been a super rewarding aspect of transitioning into academia from that healthcare background?
The cool thing is really having those aha moments with students when you can see the actual, I always tell them they've got a conversation cloud over their head that you can see the light bulb come on, like, oh my God, this is what it is, how can we make that work? But really then also having a hand in changing the makeup of what healthcare looks like. Just because when I was at the hospital, everything was very siloed. No one wanted to work with anybody else because you might take my job. I don't want to share this because you may replace me with a computer or whatever kind of a thing. And now I'm kind of getting to that point where I can kind of help bring professionals in saying, guess what? Technology's here to stay, but it's not going to replace us. It's a tool. We still need people to be able to do this, but how can I make your job easier by using these tools and showing that it's not nearly as scary as it could be, and why not make your life easier, that we can do all of these other things and make it better for patients. It can make it better for employees. It can make it better for everybody in that way. So that's kind of been my drive, especially as I've been in informatics, is showing how all of these tools can come together and make all of our lives a whole lot easier. So
Yeah, for sure. So This question I've only kind of started asking recently, and I like it because everybody's answer is really different. So, how do you define health informatics?
How do you define health informatics? It's a great question because there are so many different ways to interpret it. And really, what I do, how I define it is it's all about using technology to enhance learning about healthcare, at that point. So, I mean, we collect so much data on a regular basis that it's overwhelming. There's no way we could ever do anything, but technology has allowed us to be able to go through all of that data and find some really cool things that we would never have gotten had we not used technology to do it then. So it's all about using technology as a tool to help us be better, at what we do. So,
Yeah, I love it, and everybody always puts their own, lens on it, like,
mhm,
based on their background, right? Like, so if you're in a clinical setting, often it's like, "Oh, the clinical lens," but I
yeah.
heard you say that it's gonna impact how we're learning about healthcare even,
Oh
so
my
from the
gosh, yeah.
academic lens, right? Like, that
Yeah,
totally makes sense, and then preparing that next generation of people going out into the clinical world, I guess, and making those impacts, right? So,
yeah.
right at the source, that's super awesome.
Yep.
Um what about, like, your background, if you think about, like, medical records, has
Mhm.
that or how has that shaped your approach to health informatics education?
Oh, I love this because so many health informatics don't even think about HIM, because more times than not, it's a clinical analyst. That's usually it's a nurse or it's somebody from a clinical side is being put into that, and they don't think about it. So many times, and HIM has always been that wicked stepsister, kind of thing that seems to be out there. That oh my God, they're coming to tell me what I did wrong. But in all reality, we've always been there to help you do it better at that point. So, I always love this and I love to see your face on that because I would talk to a nursing group the other day and we said we always hated HIM coming up because they were going to tell us that we were doing something wrong. I said, no, I always like to come to tell you to educate you, even when I was at the healthcare and at the hospital, was if you document a start and stop time for an infusion that lasts 17 minutes, we're going to get reimbursed better than if you don't give me a stop time. Guess what? That's now an IV push, and I'm going to get about $5 for it versus $30 that I could have gotten for it. So and helping everybody understand is the HIM side of it. We touch on everything, not just a clinical. So I'm not just a nurse. I'm not just a therapist. I'm not just a. I've touched on all of those things because I've had to look at all of that from a coding standpoint or all those others. And I can help enhance what you do, and be a real teamwork approach, to make it better then.
Yeah, absolutely. And a lot of times when I talk to nurses, they talk about how they do what they do because they want to help people, right? So that's
Yeah.
the
Yep.
mission side of things. But just earlier today, I was having a conversation with a health plan COO, and he was saying, "Yeah, but," and I get that, right? There is a mission. That's why we exist. But
Hmm.
he's like, "There's a nun that used to run this hospital that I worked at, and she always used to say like." No money, no mission, right?
Yep.
So from the billing
Hmm.
background, like how you're able to charge for things is important
Yeah.
because that's going to determine the level of impact you're able to make because it
Yeah.
dictates the resources that you have.
Yeah, it's not going to change our mind about what we're going to do, but it should change our mind about what we do, because it shouldn't be based about how much money we're making. But if we don't make money, we can't keep the doors open and we can't provide those services. So why not maximize what we're getting based on what you're doing? I always love it in this office. I don't have it, but it's like if it's not documented, it didn't happen. So if you don't have it in there, I can't put a charge on it. I can't get reimbursement for it. So why, then why do it then? So, helping others understand yeah, and I love nurses to death. I've got great friends that are nurses, and yeah, I've got a couple adjunct that way too. But nurses are nurses and they are all about patient care, and they forget about the other sides of, that you have to consider the documentation that goes along with it, what are those parts and pieces that they don't get taught in school or they have to learn on the fly, and it depends on who's teaching them on whether or not they're going to get it or not. So it's a team approach. Healthcare is teamwork. So teamwork makes the dream work, right? So how do we keep the doors open in any way but working together to maximize that then.
Yeah, absolutely. So, thinking about the future, I mean, you touched on AI a little bit, but how do you see the role of health informatics evolving in the next few years, and especially like in rural healthcare settings?
Oh, rural healthcare, especially. AI, at first I was very hesitant, kind of thing. It's like, oh, it's technology's a little, and I want to see how this evolves. But AI has really come to the forefront, especially in healthcare, is helping provide that extra piece of help to, different groups. I could never imagine being a doctor who has to remember that there's a 500,000 different things to treat this one condition, and what's the dosage that goes along with this to that, whatever. I really do see AI playing more of a role of helping support that like order entry and different things like that helps us with those contraindications or anything, that helps us keep from yeah, horrible to say, but killing a patient because of a simple misstep because they didn't realize that something doesn't work with something else then. So I see AI as being used as a tool that helps us kind of, are you sure you want to do this because of XYZ, at that point, versus saying, you're only going to talk to a screen and they're going to be the ones diagnosing you and you're never going to see a human being again. That's not, I don't see that happening, but I do see it as a tool that we're going to use to help better treat you because we're better educated then at that point, so, or better supported, I guess, at that point.
Yeah, for sure. And what you said just reminded me of a conversation I had just a couple weeks ago, even saying something to the effect, and I don't remember the statistic exactly, but it was something to the effect of like 70 or 80% of deaths that happen are from preventable causes.
Preventable. Yeah, it's crazy. And
Yeah.
it costs us billions of dollars as a healthcare industry to correct those errors. If it, I mean, even if it, no, horrible, even if it ends in death, there is still some kind of negative monetary ramifications because, the lawsuits that could possibly come with family members, but also treating something that could have been prevented long term, because of a simple mistake, that could have been easily avoided had we had something, a checks and balances in place that would help us with that then. So,
I think at some point, like the level of information that has to be kept track of is
mm,
too much
oh my gosh.
for the human mind, just like in general. But then when you throw on like time constraints
Oh
and
my gosh.
cognitive load and all these other things that impact someone's ability to provide care,
Yeah.
and just having a conversation with someone while you're going through the medical records and everything,
Hmm.
and the EMR, EHR. So it it comes to a point that it's like there's like something has to change, right? And
Hmm.
AI provides that opportunity because it can digest that level of information, those,
Hmm.
however many pages, a 40-page intake form or whatever it is
Yeah.
that like we simply don't have the capacity, the bandwidth, the time
Yeah.
to
Yep.
digest.
And it's a snap of your fingers and it's already said, here's what, the suggestion would be, so,
Mhm.
not to mention we're doing less with more again. I mean, there are not very many people going into, to be family doctors anymore. There's so many things that go along with that, but we're trying to do less, more with less people even. So, how can we better, but then also trying to balance, work life, burnout, all of those things, this is, a good tool I see as help reduce some of that burnout, because it does help us be more efficient. I don't have to sit there and read through the 300-page EHR now, to be able to find that one thing. Whereas now it's already recognized. I've got a quick synopsis or a dashboard that says, here's your highlights, about this patient, and something to look for or something to keep in mind as you go forward then. So,
Yeah, absolutely. With that though, I wonder, does your program have you guys started exploring well AI, but also like the responsible enablement of AI? Because I know there are a ton of concerns every time you talk about it. Like, well,
mhm,
what if it makes errors, or what if as the model learns it
mhm,
degrades? Right?
yeah,
And even today, like I was using Chat GPT to analyze a pretty simple Word document and give me a
mhm,
summary, some bullet points from it.
mhm.
And one of the bullet points made a massive error. I mean, it said
Ah,
it quoted something that saying like it was $50 million when it was 5 million. And I'm like, how
Mhm.
did you, like, you're a computer, how did you make that error, right? Like,
Yeah.
and I asked it to verify like 2 times, and then finally it was like, "Oh, you're correct. That was supposed to be 5,000,000." I'm like,
Mhm.
I feel
Had you
like,
not caught it though, you
yeah, I mean,
know?
that would be massive, right? And like
Mhm.
Excel doesn't make those kinds of errors. So
Yeah.
like a large language model, it's different, right?
Well, and you gotta consider too is AI is still built by people. There's still going to be that implicit bias that's built into it without us even realizing it, you know? So there are some of those that we have to, that the little caveat that we have to keep in mind though too is that while it's a wonderful tool and is pretty accurate, it's not 100%, and I don't think it'll ever be 100%. That's why I always think say it's as a tool that it still needs that human interaction that says, oh, wait a minute, this doesn't sound right, or let's double check this, before we go forward. So I think that's where that human connection, there's always going to need that to verify it. It may suggest it, but it's not going to be the know all be all. I don't think. Of course, it's going to continue to get better, but I don't think we're ever going to be able to be replaced by, a computer at that point. So,
Yeah, for sure. So thinking about innovation and initiatives and things, what kinds of things have you been able to be a part of in the university program, or innovations that you've led, or innovative projects that you've been really excited about? Does anything come to mind?
oh yeah, we've got some fun stuff going on here at the university within the department. Is one, I don't like textbooks because one, textbooks are out of date before they're published usually, and two, I want students to get hands-on experience. So one of the fun things we've just started doing in the last year or so has been implementing real-world scenarios. So we're working with local organizations of saying, hey, what's your problems? What are those touchy points that are helping would help you do your job better, kind of thing. And we've actually worked with a couple local organizations, one to help create or do work with a transportation study, and you think, okay, what does transportation have to do with healthcare, at that point? And in all reality, you have to think about it. If a patient cannot get to their doctor's appointment, they're not going to follow up. They're not going to go and see those things. So here in Findlay, there's only one public transit, and it's a call, get on a schedule. They get to you when they get to you, So it's a little bit harder, So, but the whole social determinants of health has been really opened up our options is we've worked with United Way. We're working with another organization that does evaluations for children's reading groups. They have a tool that they have been always using, but they didn't like it, so they said, hey, can you come in, take a look, get all of our points that we would love to have. And we had students actually develop an app, go back to the organization. They're actually piloting it right now. And then we're hoping to be able to roll that out to put the app on a big scale so that others may be able to utilize that then. So real world experience, it's no longer a case study based out of a book. It's real life. I want you to go out, you're meeting real people. It's not just somebody who I'm simulating. You're going to talk to a group, and be able to do that. So making them communicate with others, ask questions, understand bigger picture than just that obvious then. So that's the fun stuff I love to see. I don't want to, they're not getting lectured in a room for hours at end. We're dropping lectures to 5 to 7 minute little snippets that says, here's what you need to learn. And guess what? When you come into class, we're going to do something. We're going to be hands on, So I don't want you to read, yes, I'm going to throw a couple quizzes at you every so often, but it's not a regurgitation type of program. It's hands on, working in groups, team dynamics, all of those things then. And not only within the program, but the community, at that point. So,
That's so great in so many ways. I mean, I'm sure it's a lot more engaging for students,
mhm,
and it's more relevant, right? Because it's real time, it's current
mhm,
issues. Also, it's uh, actually figuring stuff out and not
yeah.
Googling now or using AI now to figure out, like, well, how
Mhm,
was this case study in a textbook previously solved? What's the right
yep.
answer? And it's like, no, we actually have to uh, exhibit that problem solving that's
Yep.
so critical in so much of health informatics, right? And flex
Yep.
that aptitude. So, how do you go about? Beyond the case studies, how do you integrate real world applications like AI and data visualization tools into your curriculum?
Yeah, so those are essential pieces anymore because, that's what industry is looking for. So AI, we have a research course that's one of their first courses that they take in the program, and I put AI right into it because, like I told them, I said one. It was funny. One of the first classes, I told them, I said, okay, I want you all to have a ChatGPT login and password by the next time we come in. And they all looked at me and kind of giggled. And I said, yeah, I'm asking you to come with AI, at that point. And one of the girls looked at me and she giggled and she's like, and you don't think that we already have that, kind of thing. I said, no, I know you do. I'm going to show you how to use it correctly then. So, and that's what we've been trying to do is show them. I like to, I had a board member also tell me, give them all the bells and whistles to show them all the things that they could use, because when they get to the field, they may not be able to use all those, but they can also help encourage those in the field to be able to use those things. So yeah, so we put AI right into the program that says, we want you to use it, but we want you to use it ethically. We want you to use it correctly. I don't want you to put in the prompt for the assignment and let it, spit out everything that you want. I want you to show me, how did you outline it? What did you gather that information? How did you verify that the information was correct, at that point? So we put that right into the program and utilize it. We started right off the bat to show them how to do it correctly, and then we show them how it's utilized, how to analyze thousands of pieces of data. How do we use it to then work with the Power BI or Tableau or any of those things to really push that data visualization. Is we want to show them how to gather it, how to use it, show them how it's not nearly as scary as it looks like it should be, but to build it, and do it. We always say it's in a safe space. They can ask the questions, they can try to break it in the classroom, but then they can see all of the capabilities that all those things have before they go out into the field then. So we want to, anything new or coming or whatnot, we try to play with it. Let's, yeah, it's going to use it. Yes, it's going to work. No, it's not going to work, kind of thing. So, but we show them that it's okay to do that, and the next big thing may be coming out, or it may fizzle out next week, or be bought out by one of these other ones. We did a really quick switch to bring Tableau in, and then are finding out that Tableau is slowly being replaced by Power BI and some of the other things. So how do we modify that? We've got to be dynamic, and that's one of the big things that we like doing from the program standpoint. Is we want to be dynamic to adjust to what is going on, what's being used, what could be used, moving forward then. So, and showing them how to do that.
Yeah, that makes so much sense too when you think about like a safe space to play. Because
Hmm.
if students are coming from like there, a lot of students are probably not coming from their undergrad program or the master's, right? Like they've had some years
Nope.
of experience and maybe
Hmm.
they're in a clinical setting, and there you make decisions based on uh, evidence, right? So it's
Hmm.
like you
Yep.
don't get to. It's a lot harder to experiment because people's health and people's lives are on the line.
Live. Hmm.
So it's not a safe space to play. So now that you're in a safe space, it's probably like it takes a little bit of like stepping like toe into the water kind of thing to like,
Yeah.
okay, I can really do stuff and not worry about things here.
Yep. Yep, and
That's
showing them it's okay to make a mistake, because guess what? We learn some of our best lessons from the mistakes that we make. Yeah, guess what? If we did this in a classroom and this happens, yeah, if we were in a real world, patient's dead. Okay, but guess what? They're not. So how do we make sure that doesn't happen, in the real world? So, helping them, but also helping them think on their feet that, it's not always going to go 100%. Technology isn't always going to be right. All of a sudden technology goes down. How do I do this? I case in point, one night I was making supper and the electric went out, and I was right in the middle ready to make mashed potatoes, and I thought, I can't do it. My mixer is an electric mixer. I can't do this, and I was like, you idiot. I mean, there's other things you can do without technology to do the same thing. Yeah, my potatoes might have been a little bit lumpier than normal, but we can shift and be able to do all of these things without it. And but also knowing what's our next steps if something happens. So being able to think on our feet, thinking critically, thinking outside of the box that says, yeah, this is how I would do it, but guess what? This could happen. So how do we adapt then at that point? So helping them think outside the box is a big thing.
Yeah, that's super interesting. I have heard people talk about, EHR going out for whatever
Oh,
reason,
mhm,
and suddenly everybody that's newer on the floor, I guess, freaks out, right? Because, well,
mhm,
everybody freaks out, I'm sure, but what are we supposed to do right now? Like, what is
mhm.
paper charting? How does that work?
What is
But
that?
yeah, yeah, but, like, building in, like, okay, this is how you operate. It's great to leverage the technology, but it's good to know how to operate and still, care for patients without it, right?
Mhm. Yep.
That's
We can still go on as business as usual. It just looks a little different then. So, and being able to do that on the fly, especially.
Yeah, yeah, because everything I feel like is on the fly probably in a healthcare
Mhm.
setting, right?
Yep.
That's super interesting. And do you have, so you mentioned, the case studies that you guys do. So I'm assuming you guys have specific partnerships or collaborations with other healthcare organizations that, bring those to the students?
Yeah, and a lot of them are so I have an advisory board, of course, for the program, and so of course they're all rooted in the industry. So I'm always, bugging them. Okay, tell me some cool things that are going on. So tell me some scary things that are going on. How can I implement that in? How can can you be brought in as a speaker? Tell us your experience, the good, the bad, the ugly. Those kind of things. Help us be as dynamic as possible because yeah, it's just, my kids are one of those, yeah, mom, whatever, kind of thing. And students are that same way with instructors is, yeah, you've been out of the industry for how many years, I still, I want to stay connected in that. And that really does also, not only does my advisory board do that, but many of my adjunct instructors are also still working in the field. And that's another really cool thing that we do is a more of a team collaboration of developing courses. Everyone who teaches on campus is teamed up with whoever teaches it online. So we're always teaching, it's the same content, but we always are keeping it dynamic because those adjuncts or outside, stakeholders come in and say, here's what's going on in the industry. We're tweaking curriculum, but building it together to stay up on what's going on because they're still in it, and it helps us, those of us that are full time in academia, it does help keep us relevant, helps us stay current, but also providing those real world experiences to the students in a way that, I think is a little different than most academia.
Yeah, so is there, like, an issue that consistently keeps coming up when you reach out to your industry partners? You're like, "What are you guys wrestling with?" Is there something that you hear repeatedly?
A lot of it is the technology piece, especially with patients being one think that they're spending their providers are spending more time on their computer than spending time with them. But also from the provider standpoint is that they're having to document everything, which is taking away from their patient care. Then also. And completely get that, is like, oh, it's so much easier if you can just click, click, click this, but those I had a physician come in one day and he says, "Do you realize it takes me 37 clicks to get to this screen?" And I was like, I guess I'd never counted them before. But he was helping me understand is that, yeah, while it's good information to collect, it's also taking away from his patient care time then also. So, I mean, having to, yes, we need the data. Yes, we want to be able to see it, but how do we make sure that we're not missing the point of providing good patient care in an efficient way then also? So, yeah, it's great to have it, but what's the most important stuff that we need to make sure that we're highlighting then?
Yeah.
So,
Yeah, that's super interesting. Um, what's the makeup of, like, your student body? Like, the students that are coming through, are they coming through from, like, pretty much, similar background, or they have kind of a variety of backgrounds that have led them to this Master's in Health Informatics program?
we do have a variety of students. We do have a high international number right now, but they're all, I've got dentists and pharmacists and nursing. I've had a few environmental science students come through, healthcare management, those. So it's a very broad range of students that are coming through of all levels. Some are kind of working them through the education, but I like seeing, especially I love seeing the ones that have been in this industry and coming back because they can really apply what's going on in that clinical side and help us to be able to show, how does it all work together then. So, but also having that kind of that interdisciplinary conversation on a regular basis that we don't have to go to another program to get that because they're already making up the classroom then. So, the dentists are talking to the pharmacists who are now talking to the nurses who are, and now everybody's kind of seeing how it all plays together that, yeah, we all need one another. There's no one profession that can treat a patient from start to finish, so, understanding is we do have to have that teamwork. We do have to have that communication, open line, but also using technology to kind of help bridge it all together and make it all work, make sense then.
Yeah, absolutely. So with all these people, there's so many coming from industry and different professions. Are they coming with the goal of taking what they learn and applying it to their current role, or are they coming for like looking for a new job or transitioning in some way? Like, yeah, what's the goal that most of the students have?
A little bit of both. So a lot of them are, of course, looking to get ahead, kind of thing. So they're looking at what kind of tools can I utilize that, helps us identify trends. What's that next thing that we can help to be able to improve. But then, they're also looking at, how do I get out of patient care? So I do have a good amount of them as, okay, I'm getting older. I don't want to have to be the one who's transporting a patient from here to there, but I still want to be involved in their care, so how can I do that? And, how do I get those tools to be able to do that? So I kind of see a mixture of both. One, they're trying to get ahead, maybe more of a managerial role, or the others are, okay, I still want to be in it. I still want to be there to help, but I don't want to do beyond that, and I don't want to have to be the one handling the patient anymore, So I do see a mixture of those two types of people are the ones that are looking for the program then.
Yeah, absolutely. Tell me about mentorship. What role does mentorship play in your work? And then also, is there a component of mentorship with the students as well?
It is actually something on our to-do list at this point. So we do a mentorship through our faculty. We always every new faculty that comes in is teamed up with someone who's has experience. So has taught a few years. It may not be a full-time person in the program, but it could be someone who has been an adjunct for multiple years for me. So. But I always want that, someone that they feel comfortable that they can come back and talk to. How can they help? How can I help you build your class? Or but then how can you help me stay current on what's going on in the industry? So we do highly encourage that one, we're always talking to one another, understanding what's going on, understanding how the program all kind of fits together, at that point, but also evolving, keeping up with it then. We did just bring in a new adjunct who is actually a graduate of the program, but he has been, even when he was a student, he's like, I want a student group here for our program. And now he's like, okay, now Jen, we're going to do this now, So, but we want to be able to see that, show them, mentoring from the program. But I'm also working at building a mentorship outside with our advisory board, with local community, helping them understand is networking is essential in anything. Anything that we do anymore, it's all about who and how I can help, and if I can prove to someone that I'm really good, they're willing to talk to someone else to be able to help us get somewhere. So that's one of the big thing. One of our to do kind of in the next year is getting that student group going, and then getting those students partnered up with, mentors outside of the program and within the industry to shows we do know what we're talking about. There is a reason why we're doing what we do, and then helps them better prepare to transition right from the program right into working in the field then. So, but that is something, oh, well, it's coming soon. So
Sure, sure. When you have those conversations with people on the board or people in the industry, do they come to you and say, "Hey, when we get students out of master's programs in general, these are the types of skills or that would be most helpful for them to have, or these are
yep.
the things that are often missing when we see a mass of applicants wanting, to compete for maybe just one or two informatics roles." Like, what kinds of things are you finding that they're talking about?
Yeah, they're constantly telling us those. One of the big things is that, hey, we all use Excel, but we've got people coming in who have no idea how to use Excel. So that was one of the last things we just implemented. It's an admission room requirement that, and 98% of our students has to do this class because it gives them a nice baseline of Excel, help them understand what's a pivot table, how do we make it make sense, because sometimes that's all an organization has to do data visualization. So yeah, it's not the best thing to do, but if it's what we've got to work with, then we want them to do that. So um you know and there's so many times that we also hear is that students coming in, younger ones, is, oh, they've been grown up with technology, so they know how to use all of this stuff, and they don't, because we all assume that they know, so no one actually follows up to make sure that they do. So Excel has been one of those big things. Another thing is that no one knows how to communicate anymore. It's got to be a short text message, or how do you use proper, don't use jargon, don't how do you actually talk to someone, at that point. So those soft skills that we've kind of gotten away from, but coming back to understand is, when you're talking to somebody, speak and look them in the eye, feel, I like to tell them that when someone looks you in the eye, it shows how confident they are in what they're telling me. If you can't look at me, and you're looking all over the place, more than likely you're not comfortable or you're not solid enough in your information. And you may be the expert of all experts, but if you don't show that confidence, they may dismiss you at that point. So, but some of those are some of the big things, the Excel, the soft skills, communication kind of thing, that they're constantly saying, hey, this is what we're looking for. This is what we're needing then. So,
That's so interesting because so much of the focus is on AI and new technology and everything, but so much of the need also, not of the program, I just mean focus in general. When I have
mhm,
conversations with people in informatics, are like, oh, this is what's coming. It's AI, it's this and that. But so much of it is going back to the basics. I mean, oh,
yeah,
you really need to still focus on
yeah,
communication skills. That's been around forever, right? Like
yeah.
core basic things. And then Excel. And you're like,
Mhm,
oh, okay, yeah, I guess like the basics are still really
mhm.
important. We can't just skip that.
And it's one of those, if you can't create a good foundation, you can't build on those. And if you think about it, Excel plays such a pivotal role in most other programming, because you're usually using a CSV file or something that's come out of Excel to be implemented into those data visualization programs, and if you don't know what's good information to be able to put it in, then they don't. So, and that it really does. It's I think that everybody is so gung ho about the technology that we've done so well with that. We've done so well, we've forgotten the foundation of everything. So that's what putting those little pieces back in that says, okay, how do we talk to someone? How do we make sure, that I can communicate something? How do I write a memo? That's another thing. I mean, when we write papers, students always ask me, how many pages does it have to be? I said, I don't give you a page number. I don't give you a word count, because another thing the industry says is, hey, I want you to get to the point as quick as possible. I don't have time to read 30 pages of something. If you can answer it in 15 words, I want you to answer it in 15 words. But if it takes you 500 words to do it, as long as you're answering the question, that's what I want. So, I always love it when academia is like, oh, industry wants us to, it's like, no, industry wants us to be short, sweet, and to the point, because we don't have time to read all of those things. So, help us understand how can we kind of bullet our communication even to give us the highlights. Here's what it is. If you want more, I can highlight it. I can give you all the other stuff to it, but, understand how to get to the point my students laugh at me all the time because I'm constantly asking who, what, when, where, why, how. I said, and if you can't answer those five things, you haven't answered the question, you know. So, because it also makes them think outside of the obvious, you know. Most times everyone thinks about how it immediately impacts that one person, but it may impact 500 other people. So making them think about it from a bigger, bigger angle has been, essential for helping them understand those things.
Yeah, that's amazing. So do you have a course that's specifically geared for communication, or is it just built in, like sprinkled in through the other courses?
It's sprinkled in through all of it. So that's one of the things that we think we've talked about throughout everything is every course that we have, even if it's a computer based, we still have to talk about those soft skills. Is, how do you implement that? I mean, if you think about it from a data visualization or a dashboard standpoint, is if it's a harsh, maybe it's in red, but you don't want it to be an emergency. If I see a red dashboard, I immediately think there's something wrong. There's something I need to address immediately. But they may have thought, oh, it looked pretty, kind of thing. So helping them understand is that no matter what we're doing, there's a message being said or maybe even not said in everything that we do. So how do we bring that forward then and make them look at it from a different angle? Yeah, it's pretty. Yeah, it's something we can really do. But if I see green, yellow, red, it's either go, hold on, we're doing something, or emergency, we need to figure out, stop, do whatever. So, those soft skills really do play, not only in verbal communication, but that nonverbal or, any kind of
Like,
communication
yeah,
that
like
we
a
do.
technology communication
Yeah.
even. Yeah.
Yep.
Yeah, that's so interesting. So something just crossed my mind that's never crossed my mind before. So my degree was in communication, but in economics also. Would it be possible for somebody with my background that has no clinical experience to come through a master's in health informatics program? Like, does that happen?
Yeah, yeah. Yeah, I have the conversations probably once a year with students that are like, I don't do healthcare, I don't have any background in it, kind of thing. But in all reality, every single person has some kind of healthcare background. You go to the doctor, don't you?
Right. We're all consumers of healthcare.
Exactly. And we're all stakeholders. So, because at some point in time, we're going to either be sick or a family member is going to be sick. And we need to be able to understand this. We're still our own advocate, we're our family's advocate. And if we can at least understand the basics of everything, and it really comes down to that health literacy, is how do we make sure that we understand it in the community population, everybody understands it enough to be able to make educated decisions based on it. Gone are the days where the physician can talk down to you in that paternal standpoint that says you're going to do this whether you like it or not. Now there's a conversation saying, guess what? Here's what we've got to do. Let's work on what works for you, at that point. So if I'm more involved in my care, I'm more likely going to do what needs to be done, because I'm also one of those rebels. If you tell me that I can't do it, that's the first thing I want to do, so so if you tell me I can't do this, I've got it. My doctor of course loves, I love Pepsi, and he's like, you've got to give it up. I was like, yeah, no, my family won't even let me do that because they know that I need it,
Yep.
but helping him understand it, that I understand that if I increase my water and reduce the amount, guess what? I do feel a whole lot better, So, but getting that, that constant communication, helping them understand, we've got to work together in helping everyone. So, I mean, yeah, no, big, long, roundabout answer of, we're all members that need to know how to do that. So yeah, anyone could actually be part of this, this type of degree. So, or even moving forward. So
For anybody who's considering a master's in health informatics,
mhm.
what should they know about either what to expect from the program, what to get out of it, or what types of impacts it might make on their career journey? Like, what are some things that somebody should consider if they're thinking about taking this as a possible next step?
Yeah, I always encourage anyone who's interested, check out all kinds of different programs because there are so many different informatics programs across the US. and they all have different focuses. There's a lot of clinical informatics, there's a lot of population health, kind of thing. And we're kind of that. I love having a conversation with someone that says, "Hey, I'm on the fence and I'm not real sure." Well, what are you trying to get out of it? I like to bring that personal touch into it. Is what do you want out of this? And here's how I can support it. Here's who I also sometimes I'm also one of those that says, guess what? We can't help you with that, but here's a program that can. I will gladly, refer you on to somebody else that I've worked with before that I think is a better fit because I am, yes, don't ever tell my administrators this that I would ever do this, but but I want it to be the right fit for you because if you're going to be comfortable, if you're going to be happy, guess what? That person that I referred on down the road has also come back to me and says, "Thank you so much for doing that." And they're telling their, oh, and I've had a couple referrals back to me because they were so comfortable with what I did, even though I sent them somewhere else, they did still send people back to me then. So
Yeah, they know you're going to operate in other people's best interest.
yes. Yep. Yeah, I'm not just about putting butts in seats here. I want the right people here to help them understand is that, we can all make an impact here, And if this isn't the right fit for you, I don't want you to spend a whole lot of money on this. I want you to be in the right spot, to be able to do that. And I want to set you up for success. I always tell the students, I'm here, I get a paycheck because you're here. So, if you're not getting it, if you're not, that's on me, because I need to be able to help you, make it make sense to you, at that point. So, I'm not just about, oh, you red line, I'm failing you because, I'm going to figure out why are you failing and how can I support you to help you be successful then. So, and I want that to translate all the way out, is when you go out into the field is you need to be talking to that next person that says, how can I help you? If you help me, I help you, we all win, at that point in time. So, or we all fail. Sometimes it happens that way too, but it is what it is.
Sure. Absolutely. It's so interesting. What would you say would be, I don't know, what you would consider to be a successful outcome, I guess, for somebody that's going through a master's in health informatics program?
I think a successful outcome, of is hooking up with the right organization after here. Most people think that from a health informatics that you have to go into the health to a hospital. In all reality, especially with social determinants of health these days, and like some of the things that we're doing with organizations, I w- I think the success if I could get 90% of my students on grassroots level organizations, being the ones helping them get resources to the right people. Because not only are we supporting the people of the community, then we're also supporting those healthcare systems because now the right people are getting the right services that get them to the right, that helps them all the way along the world. I mean, it's horrible to say this, but I mean, Jimmy Carter was the first president or even the first person out there that says we have to treat a community to improve healthcare outcomes. We can't just treat the patient, or treat the one person because, yeah, we can get somebody there, but if they're not supported at home, if they're not supported to get there, if the infrastructure is not there, they're not going to be successful because they don't have that support to be able to do that. So that's where and it's kind of how what's a little different from our program is I'm looking at it from an organization standpoint is how can we help you do those things that you wish you could do but you don't have time um to support it. If we can get the right resources to get an evaluation tool to a mentoring group which then identifies a patient that needs maybe some mental health services that can get them referred quicker, before something happens or any of that, it's a success all the way across the board then. So, and that's kind of where I'm at is those outcomes are what I'm looking at. Yes, I would love to see 100% of my students or graduates be employed immediately in big organizations, EHRs, vendors, whatever. But I love the ones that I can get into community organizations that can immediately make an impact with those groups then, and then we see the community really improve then from there. So
Does it, speaking of, loving to see everybody employed right out of the program, does it vary from student to student, or is there like an overarching common barrier that prevents recent graduates from like a master's in health informatics program from
Mm.
getting employment? Is there something that you're hearing like over and over, like, oh, they need more of this or something like that?
We do see a lot, especially here. We're a little bit more rural. We're about 45 minutes away from Toledo, and we're about half an hour from Lima, so a little bit bigger towns. But a lot of them don't have per se health informatics programs within it. Then they may be called something different, So students coming in think that they're going to get a health informatics role. That doesn't always happen. Now, if they're willing to expand out to those bigger cities, they may be able to get that. But those that are wanting to stay more local, sometimes it's a more challenge of trying to sell themselves to organizations or whatever that says, "Oh, this is a good role, and here's how I can help you." And that's some of the branding that we're trying to help with students is that just because the job description isn't what you think it should say, we want you to say, guess what? This is what your job description's asking for. Here's all the things that I know how to do. I can support you 100% in that. It may not be the same degree you think I should have, but I have all these skills to meet those then. So,
Yeah, and it's so funny that you use that example because I've literally helped someone that was transitioning from a speech pathology background into a nonprofit role
mm,
by using ChatGPT to analyze the job requirements and then look
yep,
at her resume and say,
yep,
hey, even though it's not a direct experience or directly equivalent, it's not like this title is the same as that. What have I done that demonstrates that I have those qualities and skills and experiences that you're looking
yep,
for? And
yep,
it put together, and we had it write a cover letter. And then when she got the offer, after she got hired, the organization told her this was one of the best cover letters we've ever seen. And it's
yep,
like, yeah, it was Chat GPT just showing you,
yes,
hey, I've got what you want. I just have to communicate it in a way that
yep,
helps you see that. Because
yeah,
if you leave it to the hiring manager, often they're not going to just deduce that
mhm,
on their own, right? Like you have to
yeah.
make it clear to them. But once you
Yep.
do it, then they're excited to bring you on.
Yeah, because if you're not hitting exact keywords that they're looking for, they've thrown your resume out the window because they don't think because oh, this is what your degree is, you don't meet these. So if we can show you how those same things meet and I love that example because ChatGPT can easily match use this job description and match it to my experience and help me word it in a way, that makes it make sense then. So um I love that, and then not to mention is that we're trying to even create in the courses is how can we give you like certificates and stuff. So our project management class, we build it around PMI. So the Project Management Institute, they're getting hours towards their PMI certification. They're getting, they get a white belt, so they're working on all of those things. That way, when they go out in the field, not only do they have a degree, but they have a certification in these different things. And we want every class to have some kind of tangible something out of it. It's not just, oh, I passed it. No, guess what? I've got a certification in da da da. And that's what we're continuing to try to continue to build and bolster. Because we want those resumes to say, oh, guess what? These are all my skills. This is how I meet all of this. Just because you may not think this meets, it really does. And I can show you how, at that point.
Yeah, absolutely. I love how practical that is. That's great.
Mhm.
Well, Jenny, I know we're coming to the end of our time here. Is there anything that we haven't gotten to discuss today that you wanted to talk about?
Yeah, I don't know. I think that's I love talking to different people. Of course, I'll talk your ear off about, all the fun things that we're doing and how we can help, but I love to be able to push people out of their comfort zone. I want you to think outside the box, and that's kind of one of the things I love about this program. And my dean actually has been wonderful with me because he's like, yeah, you do you, as long as we've got positive things come in, he's like he gives me free range of not free range, but he gives me some latitude that says let's see if it works. We're not stuck. I'm not in our group is not a typical academic group that we're going to set it and forget it. We're going to teach it the same way for the next 20 years. We tell every group that comes in, if you know somebody that's been in it the last semester that might have taken that class, it's going to look different, because we're going to be dynamic. We're going to change things up. And, so we want to stay, as dynamic as possible. And we're always looking at, how we can do that, and bring people in. So.
That's super interesting. If anybody listening wanted to learn more about the Masters in Health Informatics program at University of Findlay, where can they go to find out more information about it?
Yeah, so you can actually go to the findlay.edu webpage to the university, and we do have a link right to our webpage. We also have a LinkedIn page for the UF Health Informatics program, as well as each of us instructors then too, and we're all tied back to that then. So. But yeah, we love to talk about it, and we'll gladly talk anyone's ear off whenever possible to get you in the right spot then.
Yeah, that's perfect. Well, Jenny, I love the work you're doing, and I really appreciate you joining me today and sharing your insights and everything that you guys are doing there. It's super interesting to hear about.
Yeah, thanks for having me.
Yeah, absolutely. To our listeners, we'd love to hear your thoughts on this episode. You can share your comments on LinkedIn or on our website at pivotal.buzzsprout.com. And if you know somebody who'd find this discussion valuable, please share it with them. They can listen live on LinkedIn or anywhere they get their podcasts. Until next time, stay tuned for more episodes here on the Pivotal Podcast.